Welcome, everyone, to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Avalada from Roots Community Health, reporting for the week of June 23rd, 2025. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. Today, I'll provide a status update on respiratory illness and measles. I will share a recent MMWR report on Mpox, and I will also go over information coming from the CDC, from MMWR reports to the new ACIP committee that is set to convene this week. So first, taking a look at proportions of respiratory viruses, the percentage that test positive when people go into a healthcare setting. And here we can see the June 14th kind of snapshot in time, where the largest proportion are made up by rhinovirus, enterovirus, which is in the gray, and then followed by parainfluenza virus. So these are kind of just our cold type of viruses, and then followed by human metapneumovirus, which seems to be coming down in terms of its proportion. And then coming in fourth is SARS-CoV-2 in red, which seems to maybe be taking up a slightly increasing proportion of those tests. And remember, this is not including those home tests or even some of the antigen tests done in settings where they're not being reported. These are mostly going to be in hospital and outpatient clinical settings. Taking a look at SARS-CoV-2 in the wastewater, we can see that it is considered low nationwide, but it is kind of coming up in most of the regions, especially in the Western region, which is in the teal, and it is in the low region, but appears to maybe be increasing in the Western region, among others. Taking a look at COVID epidemic trends. And remember, this is really taking a close look at emergency department visits for COVID and seeing which direction they're going. And this is really overall very good news. It's not changing in the majority of the country, and it is either likely declining or declining in the rest of the country, and just a few states in white where it's not estimated or it is extremely low so as not to be able to be detected. But nowhere is it showing likely growing or growing. So this is good news so far. And taking a look at deaths, also positive news here in that it's still a number of people are dying. 181 deaths in a week is still a lot, but this is the first time the entire pandemic that we've actually gotten below 200 deaths in a week. And we now have a few weeks in a row that represent our all-time lows in terms of COVID deaths. So remember, this lags about a month behind. So this is showing us mid-May, but with everything that we're seeing in terms of how much is circulating, ER visits, hospitalizations, being that none of those have started to head up yet, we can kind of expect the deaths to continue to come down before they go back up. And so this is good that we're getting down this low. This is the first time since the whole onset of the pandemic that we've gotten this low. So good news there overall. Still need to do more work, not only to get it from 181 to less than that. We'd love to see that keep coming down and down, but also for it not to go up as high as some of our highs have been even here recently, even as recently as this past winter, and then the summer before it was even worse. So still being cautiously optimistic that things are getting better year over year. Having said that, I think we'd be very wise to be prepared for a wave later on this summer. And those are some of the indications we've been looking at in Europe already seeming to tick up. And so something we'll just have to be keeping an eye on and doing what we can to prevent. So we'll get to more of that in a moment. Taking a look at variant proportions, you can see here that what they've got on the Nowcast page is a notification that due to low numbers of sequences being reported to CDC, precision in the most recent reporting period is low. And so CDC will be moving to longer reporting periods now so that they can gather the number of sequences required to provide reliable nowcast estimates. So this is partly because less testing is happening, and partly probably also because there's a little bit lower circulation right now as well. So not clear if this is going to be kind of a permanent thing where there's longer intervals or if it's just the moment that we're in. So something we'll continue to check out and report back when there is something to report here. And now for a brief update on measles. We have gotten up to 1,214 confirmed cases through June 19th. 146 of those, so 12%, have been hospitalized. And we've had 3 deaths thus far. And 89% of the cases so far have been outbreak associated. So over 1,000 of the 1,214 have been associated with an outbreak. By way of comparison, in 2024, 69% of cases were outbreak associated. So this basically tells us that we are losing the control that we once had. Cases are no longer sporadic or just imported, they are spreading locally. And the 2-dose vaccine series has been thought to be 97% effective for life. So that is really being put to the test right now. It is definitely a highly effective vaccine series, but some of the cases that we're seeing this year are in fully vaccinated individuals. So does that mean that the vaccine is less than 97% effective? Does it mean that it's less durable or less long-lasting than we thought? Or are the fully vaccinated people that are getting measles right now just part of the 3%? So these are the questions we need to be asking and answering with some urgency now to guide our actions. But with such clear efforts to seemingly minimize this outbreak and to undermine confidence in vaccines overall, I'm definitely concerned that resources and efforts are not going into this direction. And that is especially concerning given that we are in summer travel season. And there have already been multiple reports of outbreaks that are linked to travel. And I've put the article in the post that lists several instances of travel-linked measles in the United States, from Dulles Airport to the train to DC buses to Boston museums, Logan Airport to Miami, to positive individuals going through Phoenix Sky Harbor Airport, as well as potential exposure on a bus trip between Denver and Boulder, Colorado, not to mention all the coffee shops and restaurants and other venues that these people visited. This is all just in the month of June, this month, which is not over. So I'm very sorry to say that we have no reason that I'm aware of to believe that the situation is going to improve anytime soon. In fact, all indications are that it will likely get worse, and I'll go a bit more into why in a moment, but just the fact alone of travel-linked cases as we are into the swing of summer travel season alone is enough for some concern. So let me say that if concerns about transmission of SARS-CoV-2 on airplanes, buses, and trains are not enough for you, we can now add measles to the list of things we're trying to avoid. A well-fitted N95 mask provides excellent protection from SARS-CoV-2 as well as measles. So if you are traveling, wearing a well-fitted N95 is certainly advisable. We know that airplanes are small vessels with a lot of people on them, and air gets very well mixed inside of planes. So transmission is just a great place for transmission to occur. And of course, the sheer volume of people you encounter in airports, train stations, and so on. And it only takes one positive person to get multiple people infected, who then get sick and may go on to start their own chains of transmission. So wear a mask, break the chain, or at least don't be part of the chain. Now I want to briefly touch on this recent Morbidity and Mortality Weekly report regarding Mpox. And I want to touch on it for a few reasons. So first, a quick reminder, there are 2 categories or clades of the monkeypox virus, Clade 1 and Clade 2. The Clade 1 outbreaks have generally been more severe, have affected more children, and are occurring primarily in Central and Eastern Africa. Clade 2 is the one where we had the recent global outbreak that we managed to pretty impressively get under control quickly here in the United States, but there still is low-level spread throughout the United States and many other countries in the world. The infection causes a lot of discomfort, can be very painful actually, and disfiguring. And in people with immune compromise, such as HIV that isn't treated, it has been deadly. Unfortunately, we do not have a good treatment for Mpox, but we have a pretty decent vaccine. It's a 2-dose series, and those who are at risk should have received this 2-dose series, and if not, they should, in order to prevent or to lessen the impacts of infection. And so this MMWR report talks about something very specific, which is Clade 2 Mpox infections among cruise ship passengers and crew members in the early part of 2024. So it might have been nice to get this report a little sooner, but here we are more than a year later, just in time for cruise season to share this information with you. And the bottom line is this is talking about 8 Mpox cases on 4 cruise ships, 4 among crew members, 4 among passengers. All of them occurred among men who have sex with men, and 5 of the individuals had not been vaccinated at all against Mpox. So if you're interested in the details, I've linked the report in the post, but here is the bottom line of the guidance coming from this MMWR report. Cruise lines should consider educating crew members on Mpox symptoms, risks, and prevention. They should also facilitate Mpox vaccination for eligible crew members. And cruise passengers who are recommended to get the Mpox vaccine should do so before they travel. And cruises marketed to gay and bisexual men should provide Mpox prevention messaging and education before and during the cruise. So I want to talk about this today for a few reasons. One is because we haven't talked about Mpox in a little while, but it still is impacting folks, so we need to keep it in mind. Secondly, because this is new information. We haven't seen anything previously regarding Mpox and cruise ships, so this is just good information to add to our knowledge base. And lastly is because I'm getting a lot of questions about information coming out of the CDC in general. Is it accurate? Can we rely on it? What should we expect going forward? And I'm going to get into this more in a moment when I talk about the Advisory Committee on Immunization Practices. But we know that the MMWR reports are an important way that the CDC communicates relevant and timely information with healthcare providers and with the public. So I wanted to talk about it for a moment here as well. So you might remember that earlier this year, there was a complete pause placed on MMWR reports where we just didn't get any for several weeks. And then since then, it's been kind of a slow trickle. We don't seem to be getting reports as frequently. The reports we are getting also don't seem to be as robust or as consequential. So on the one hand, I think that this is a solid report. I'm certainly glad it has been shared. It's important that these connections are made and that is brought forward so that those who are in the work can keep these things in mind and improve our patient care and our community education. On the other hand, I am becoming increasingly concerned with what is not being shared. We have what really still is a novel virus, SARS-CoV-2, where we're learning more information all the time, yet I haven't seen an MMWR report regarding COVID since last year. And despite the fact that we are currently experiencing the deadliest measles outbreak in the United States in decades, there's only been one MMWR report this year regarding measles, and it's nothing more than a status update telling us basically exactly what we already know. So I guess the good news is that we are getting some reports that appear to be credible and well done of public health significance. They appear solid. They're producing some recommendations, but I'm increasingly concerned about the reports we are not getting, the data we're not getting, the communication we're not getting regarding things that are critically important to us all. And even more concerning are the changes happening with the CDC's advisory committee. As I report last week, HHS Secretary RFK Jr. abruptly dismissed the 17-member Advisory Committee on Immunization Practices, ACIP, replacing it with an 8-person committee that appears to be personal appointments of RFK Jr. The ACIP has historically been really a globally recognized advisory group with members that have been carefully vetted over very rigorous processes that could take up to 2 years. This selection process ensured expertise and addressed potential conflicts of interest, with members recusing themselves when necessary, where the newly appointed 8-person committee lacks the demonstrated expertise. We know nothing about a rigorous selection process, and we just don't have the transparency that we've seen in the previous iterations. But nonetheless, this committee is scheduled to meet this week for 2 days. And several of the agenda items that we had anticipated and that I've mentioned over the past few weeks, such as the new FDA-approved COVID vaccine, that's more specific, and the mRNA vaccine for respiratory syncytial virus, RSV, these are conspicuously absent from their revised agenda. And amidst, again, the deadliest measles outbreak we've had here in decades, a discussion on the efficacy of MMR vaccine or anything about measles that might be salient to the current outbreak is also not on the agenda. Instead, the agenda includes discussions on topics that I think are widely considered to be settled science. For instance, on Thursday morning session, they're going to have a focus on thimerosal and vaccines. Thimerosal is a preservative. It was basically largely removed from most all vaccines decades ago, really due to anti-vaccine activist rhetoric, despite extensive and multiple studies that consistently showed its safety and no link to autism or anything else. And it is now scarcely found. It's primarily only found in multi-dose flu vaccine vials, which is the subject apparently of the ACIP discussion. The decision to remove thimerosal from everywhere else seems to have been a precautionary measure to prevent vaccine hesitancy. So it wasn't even due to any safety concern. And this was done decades ago. And decades of research have absolutely disproven any connection between thimerosal and autism. And I think it's important to say that the incidence of autism has continued to rise even after thimerosal's widespread removal. So I think this further undermines claims that are unsupported in the first place. The presenter for the thimerosal discussion is currently listed as TBD, and so is the leader for the discussion on the vote that's to be taken about thimerosal containing influenza vaccines. Typically, if there's new data, the review of that data occurs ahead of time within working groups that are comprised of CDC staff and ACIP members. So given the abrupt dismissal of the previous committee, I think it's highly unlikely that these working groups happened, that they've convened at all. And I'm not aware of any new data regarding thimerosal to consider. So this agenda is rather concerning, particularly when we are confronting significant public health issues like the current measles outbreak, when we, I think, again, would be wise to anticipate a summer COVID wave, that we are not really doing anything in particular to prepare for. And we have new FDA-approved vaccines for both COVID and RSV. And instead of addressing these consequential issues, the committee is dedicating time to a topic of little consequence and with no new supporting data. So even if they go ahead and vote and decide to remove thimerosal or ban it completely from its current limited use, it's probably fine. I don't think it's going to do anything. It's not expected to impact any health outcomes whatsoever. And it might increase the cost or decrease the accessibility of flu, because it's the ones that are in the multi-dose vials, which tend to be more cost effective. And the alternative, which is the single dose vials, tend to be more expensive and more wasteful. But this is what they're going to spend time on. So this is a troubling start for the new committee, especially when we have more pressing public health challenges that require immediate attention. So what can we do? So for those of us committed to science and fact-based information, our jobs have gotten a whole lot more difficult. We have to keep an eye on the politicized version, all this politicized information and disinformation coming from the highest levels, because we need to keep track of it, because we know that it is adversely impacting the health of the public. But we also have to figure out where to go for guidance and expertise as things progress. And I'll just mix in a little prayer that we don't find ourselves in another pandemic situation anytime soon, because we don't appear to be very well equipped to deal with the current situation, let alone any new situations. So I am looking a few places. I'm looking to the states and even regional bodies that were more prominent in the early part of the SARS-CoV-2 pandemic. You might recall there was a Western State Scientific Safety Review Work Group that had California, Nevada, Oregon, and Washington, and they would review things pretty much as soon as they came from the FDA and CDC related to COVID. That was very specific, but it was very helpful at the time because remember, we were receiving so much conflicting information from so many different sources that it did feel reassuring to have the Western states who were taking more or less a similar approach to the pandemic, to have them to convene and then put out their own guidance. I don't know that they'll be getting back together anytime soon, but that was a crisis. This is a crisis. Also, I'm looking to our medical and public health associations to see who, if anyone, might emerge as a body that possesses, I think, not only the expertise and the credibility, but also has the access to the data that is needed in order to take the place of something like the Advisory Committee on Immunization Practices. So in the meantime, now more than ever, I think it's critical that if you don't have a primary care provider, that you get one. Encourage your loved ones to get one that they can talk to, one that they trust, one where they can get their questions answered, get those baseline labs completed, get your screenings and vaccinations that are appropriate for your age and situation, know how to reach them before you're really sick, before you need them. And remember to eat a balanced diet, a lot of whole foods, stay well hydrated, avoid those simple sugars and the highly processed foods, the artificial ingredients. These have very little nutritional value at all, so they're kind of empty and they don't add any value. So a treat every now and then is one thing, but let's try to limit consumption of these items. Also, quit smoking, limit your alcohol consumption. And if you're sick, please do rest and recover. Otherwise, remember to get some regular physical activity and fresh air and manage those stress levels and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us. We will be taking next week off. Please have a safe 4th of July holiday, and we will see you the following Tuesday, the 8th at 10 a.m.